news, they don't really do the ambiance justice, do they? Yeah. They mention the price, they mention the results, but they never mention the experience. And that's really what we're all about here. An experience that you will not forget, no matter how hard you try. So just go on, have a seat in the chair. Just, yeah, right there. Yep. That is the one. It's really the only one that we have. It's our star player. Make yourself comfortable, or, as comfortable as one can be. The leather is, well, it's vintage. Let's just call it vintage. It's got a lot of character, doesn't it? It's a lot like teeth. Every little crack and tear tells a story. That big one there on the armrest, that's from a patient who was particularly tense. He fought the relaxation, so don't fight the relaxation. It only makes the chair fight back. Okay. Alright, so let's go ahead and get you checked in. I have you down for let's see, yeah, it's just a checkup. Yeah, a simple routine checkup, is that right? Okay. And your name is... Okay. Got it, yeah, it's right there. There, perfect. Now, just so you are aware, we do have a bit of a new system for our records. It's for security and, holistic integration. We need the full picture of you, not just your mouth. They say that the mouth is the window to the soul, but the social security number is the window to the credit score. And a good credit score is indicative of strong enamel. It is all connected. So, if I could just get your full name, your date of birth, and just for our files, that social security number. Okay. Okay, excellent. And your mother's maiden name? And the name of your first pet? And the street that you grew up on? Yeah, it's all for, it's for the two-factor authentication, just in case you forget which tooth is yours. It happens a lot more than you'd think. Okay. So now for the more holistic part of the intake, I just need to get a sense of your overall flow. Your financial flow, that is. It is directly related we are all set. I have everything that I need right here. And you are now fully integrated into our system. Welcome to the family. There we go. Got 1 and 2. Safety first, right? Mostly. This mask is so stuffy. I'm just going to, yeah. I can hardly breathe in that thing. So, alright, so let me. Alright, I'm just laying out our instruments here. Now I have a strict policy. I never put anything in a patient's mouth that I haven't personally vetted. It's just a little quality control. Okay, so first, of course, we have our classic mirror. You can't see the tiny little secrets without it. Yeah. Relax your jaw for me. Relax your tongue. Don't worry, I haven't lost a tongue yet. This week. It's only Saturday. Don't even. Let's not think about that. I was just kidding. Okay. Okay, we are just taking a little tour, just a little journey through the pearly gates. We'll start on, let's see, is this the left or the right? Your left or my left? It really does get so confusing from this angle. We'll just call it this side. Okay. We have a tooth. Number 1. It looks good. It's a little lonely back there. That is a molar, I think. They all look the same from the back. Like little white rocks in a very wet cave. Okay, let's go to tooth number 2. It's another one present and accounted for. Good job. You're doing great. this simple checkup, I'm afraid, is going to have to be a little bit more involved. Okay. But first things first, before we tackle the spiritual and shark-related issues, I see a much, much more mundane problem. The tooth that is right here, number 11. It looks fine. Too fine, actually. It is suspicious. There's no decay, no weakness. It's a bit of an overachiever. And that kind of perfectionism can lead to stress fractures. Yeah, down the line that can happen. So, just yeah, I can feel the tension in it. It's wound up tight. What we need to do is preemptively weaken it. Okay? So I'm going to give it a filling now before it gets cavity to show it who's boss. It is called a prophylactic intimidation filling. It's very cutting edge. I read about it somewhere. Can't really remember, but I did read about it. So I'm just going to mark that tooth. Where's my pen? There it is. I'm just gonna mark that tooth. There. There's a little X marks the spot. Now you just relax, okay? Just relax. You'll be fine. Okay, so it's just a little bit of surface removal. Okay, we need to create an opening for the filling to humble the tooth. So just open up wide. There we go. I'm just making a little home for our filling material, making it feel wanted. Okay. Now to mix the amalgam, I used a special blend. It is my own recipe. It has the standard mercury and silver, but I also It's a close enough fit. The glitter really classes it up. Okay. It's like a little disco in your mouth. Okay. That healthy tooth will never know what hit it. And that other tooth, it now has a beautiful, sparkly new friend. Everybody wins. This is what I call intuitive dentistry. Yeah, I just follow the vibes. Yeah. And the vibes told me that that tooth was the one. Okay, that is much better. I was about to do the spiritual work, but the gloves were really restricting, and I just feel like my energy is not going to be able to do its job. So I deemed it necessary to remove those. Alright, but my hands are clean, it's fine. Yeah. I just needed to feel the energies more directly. This way it'll be more intimate, more authentic. Okay. So for this interproximal miasma, the treatment is delicate. We can't just scrape it away like common plaque. Oh no. This is spiritual. We have to perform what is known as a chakradontic realignment. It involves some chanting, some crystals, and some very specific tapping. Okay? So first I need to find the resonant frequency of the tooth. Okay? See, each tooth has its own unique hum, its own little song. I just have to listen for it. Okay? So, let me just do a little bit of that is not it. That is the song of the molar next door. It's a very sad song, all about being crowned down. So let me try that again. There it is. Yeah, it's a little off key, but I can work with it. Okay, so now I have to match that frequency. I also have these charging crystals. I'm going to place them on your cheeks. Okay. Okay. How does that feel? Okay. Those will help focus the energy. But yeah, don't worry if they start to feel warm. That's your money. I mean, your bad vibes burning away. Okay. Just your bad vibes burning away. this here is a high frequency micro vibrator. It's actually for polishing dentures, but I find that it has other uses. So I'm just going to apply this to the gum line, just above the little shark teeth. Alright, the vibration, it sends a signal scent fee, a proprietary blend of dust and fear, $75. Holistic data entry service for typing your life story slowly, that was $40 per keystroke, so let's just say a flat $1,500. Holistic data security and storage fee, that's for keeping your PIN safe, $800. Personal protective equipment charge, that covers the gloves and the mask that I briefly honored, $200. The glove and mask removal convenience fee for my own comfort and spiritual clarity, that was $150. Instrument self-taste quality control test for your safety, $50 per tool, so $300. The trust calibration assessment, $250. The interproximal miasma discovery fee, it takes a keen third eye for that, $1,200. The crystal placement surcharge, crystals not included, $400. Chakra Odontic realignment, the main event, which was $2,500. Supplemental humming fee for the custom resonant frequency, $500. The prophylactic intimidation filling for the healthy tooth, $1,800. The wrong tooth application surcharge for the intuitive audible I called, $500. The glitter infusion fee for that extra sparkle, $350. The hypernumerary secondary dentition identification service, $950. The gum intimidation session via microvibrator, $2,800. Intimidation subscription down payment,